Well, hello everyone and welcome to today's webinar. My name is Yeshua and I'm the Outreach and Social Media Coordinator for the Canadian Cancer Survivor Network. And on behalf of Ccsn, I'd just like to thank you for attending today's Cancer Can't Wait Self-Advocacy in the Time of COVID-19 webinar. This time our focus shifts away from the details of specific meetings with elected officials across Canada and towards a story of those who have actively fought back and been the primary advocate for themselves throughout this pandemic. Before I get ahead of myself, if you're new to one of our webinars, let me just take a moment to give you a brief overview of our organization. The Canadian Cancer Survivor Network, or CCSN, is an organization working with cancer patients and survivors to learn about the complexities of our healthcare system, to connect with others, to plan action and act on those plans to promote better care and healthier survivorship. If you'd like to learn more about CCSN, please visit our website at survivornet.ca. You'll find plenty of information there on us, as well as news, events, and resources that we think you'll find helpful. Two quick announcements before I hand things off to our presenters. This webinar is being recorded and it will be available tomorrow on YouTube, as well as our Facebook page. I believe it's Canadian Cancer Survivor Network. The video link will be sent to the email you provided when you registered. So you can share that resource and go back and watch it again if you'd like. At the end of the presentation, we'll have a Q&A session. However, don't feel the need to wait until then to submit your questions. If something comes up during the conversation, please type it into the questions box at the bottom of your screen so we can have them queued up. With that said, CCSN is pleased to welcome our panel of advocates for today's webinar, and I'll turn things over to our facilitator, David Klug.
Good morning, everybody, or I guess good morning to those of us in Alberta and BC and Yukon, and if you're east of us, good afternoon. Thanks for joining us today. As Yeshua mentioned, my name is David Klug, and I work with the CCSN on some government and public policy advocacy. Really happy to be here today to help facilitate today's webinar and panel discussion on self-advocacy in the time of COVID. It's cliche to say after almost 2 years of restrictions that COVID has had immeasurable impact on all of our lives, on everything from how we go about buying groceries and connecting with people socially online, to accessing care and medical services either online or in different ways. Everything from cuts and scrapes and minor illnesses to cancer diagnosis and treatment and care, which brings us to the topic for today. We're very privileged to be joined by 4 panelists. We're all cancer patients, survivors, or caregivers, and who've been navigating the care systems throughout the pandemic. And they've taken some time today to join us and give us their perspectives and to share their experiences with self-advocacy for their own care or for someone that they love. We're joined today by Diane Colton, Jennifer Roy, Angus Pratt, and Shannon Gall. So happy to be meeting all of you for the first time virtually today. I know we've shared a few emails back and forth. And to start off, maybe if we can just do a quick roundtable, and if you could introduce yourselves quickly to our attendees, that would be great. And Diane, maybe you're on my upper left corner of my screen, so maybe if we could start with you.
Okay, great. Hi, everybody. Thank you for inviting me to participate in this webinar. I'm truly honored, and I hope I can be of some help and assistance and give some people some ideas. So I'm a 3-time lung cancer survivor, first diagnosed in 2011. At this point, I have nothing going on, no treatment or anything, but just my regular appointments, but a lot of navigating to do through COVID and definitely through lung cancer itself as a disease in Canada.
Thanks, Diane. And then maybe we'll move to Shannon. You're on the upper right corner of my screen. So.
It's like Hollywood Squares.
Yeah.
My name is Shannon Gall. I'm here in Kelowna, BC. I was diagnosed stage 4 in 2018 and had, I guess, a year of treatment and radiation and what have you. For the first year was pretty calm, and then COVID hit. I take targeted drug therapy, Tagrisso, and it had been a series of stable, with some mild progression in October of 2021, where I had to navigate the system to have radiation just this past December, and have had scans just a couple weeks ago. So I've been really, I've had 2 phases with COVID and cancer, and I'm happy to talk about those with everyone in further detail later. So thanks for having me.
Thanks, Shannon. Angus, you're up.
Well, I was born at an early age in Scotland. You told me not to tell my life story. And 60 years later, so I'll skip over that part. 60 years later, for my 60th birthday, I was given the gift of male breast cancer. And that was a gift that kept on giving, because in the workup for that, they actually discovered lung cancer, completely separate, primary, and much more serious. The breast cancer was stage 1, though it was in both breasts. The lung cancer was stage 3C, which is about as close to 4 as you can get without actually crossing the line. And so I was given aggressive chemoradiation with curative intent. I love those words. And was fortunate enough to get compassionate access to a drug that was new at the time, durvalumab, or that's the generic name. The brand name is Imfinzi. It's become a standard of care drug now across Canada, I believe. Unfortunately, after my bilateral mastectomies, I was, after 9 months, the scans showed that there was progression and it became metastatic. And I had gotten this phone call from my oncologist about the middle of my chemoradiation saying, hey, you're EGFR positive. And he was so excited about it. And I had no clue what that meant. But at 9 months, when I saw the progression, I discovered exactly what it meant. It meant that there was a targeted drug that I was eligible for, and a better one that I wasn't eligible for. And I began that treatment. And here I am almost 3 years later, 2 3/4 years later, still on afatinib and doing quite well. Just got a 4-month reprieve, skipping from the 3-month scans to the 4-month scans. So through the fall, I was getting a scan every 2 months because there was a spot that the doctor was concerned about. Well, my oncologist wasn't, the radiologist was. And so those were interesting travels and trying to get accurate information through in a virtual environment and all of those challenges. So much of my COVID experience, though, has been in the world of advocacy. And so we can talk a lot more about that in terms of vaccination for cancer patients and in the realm of finding support groups for cancer patients.
Thanks very much, Angus. Happy to have you join us. And our 4th panelist today is Jennifer Roy, who's joining us from the East Coast. So, Jennifer.
Good afternoon, everyone. Yes, I'm way on the other side of the country, coming to you from the cloudy and foggy Halifax today. And I am Jennifer Roy, and both my parents have passed away from lung cancer. My dad's situation happened almost 20 years ago, coming up in June, and he was diagnosed and then passed away within 6 months of almost to the day, actually, of the said diagnosis. And then fast forward to 2019, and we got the news that my mother likely had lung cancer. And after a very, very brief illness that we knew of what we were dealing with, it was 4 weeks total. She passed away on February the 16th. 2019. So we're coming up on the 3rd anniversary of that. So out of those experiences, I turned my life to dedicating for lung cancer advocacy and hoping that what happened in my world doesn't happen to other people. And that's who I am.
Well, thanks very much, Jennifer. And again, thanks again to all of you for joining us today. Just before I sort of lob a question out into the panel here, I just wanted to remind our participants that if you do have a question, please don't hesitate to add it into the question box on the, depending on where you are on your screen, and put those in, and we'll do our best to have one of our panelists answer those, or at least provide their perspectives on those. So the first question I had for everybody here, and it's a bit of a general one to get the ball rolling, was, how has COVID impacted your relationship with your care teams? And not meaning to say, you like them more, you like them less, but are you able to reach out to them? Are you able to get in touch with them? Can you get feedback from them? Has it impacted the number of times that you expected to be able to see them versus what you're able to actually see them? And from that perspective, has it impacted you? Anybody?
Yeah, I can answer this one. So COVID's definitely impacted my, not necessarily my level of care that I'm receiving, but my comfort level with the care that I'm receiving. Through the pandemic, we went from in-person to over the phone, never by Zoom or by video. So it was either in person or by phone. And there was a long stretch in there where I was stable, so it didn't really bother me too much. And then we went back to in person about 8 months ago. Here I'm with being treated by BC Cancer, and back to in person. And then, like I said before, I had some progression that required radiation, and that was a very lonely process. And when I was first diagnosed in 2018, my husband, my caregiver, was able to come with me to everything. So this was a very solo experience, going in for the radiation, getting the mask made. Not that he could really hold my hand or anything while we're there, but just mentally knowing that that person is out there sitting, waiting for you. I am not convinced that the level of care, like I said, changed because of COVID. It's a progressive disease, so it's going to progress regardless of if there's COVID out there or not. But it's been a tougher go, I think. It's just like a double whammy having cancer during a COVID era.
Diane.
Yeah, definitely with Shannon on the no in-person meeting. That sort of changes the dynamics on your speak and talking with your specialist, and sometimes it's also the questions you ask because you're on the phone, and there's just not that interaction, and there's not that synergy that normally happens. So you get off the phone and you remember that you wanted to ask something. So that was a big one. The other thing, and this is partly with me, is I like to have copies of all my results because I keep a file of everything, and I haven't had copies for a long time. So in 2019, September, I was diagnosed with a brain tumor. So I went isolation, starting with my brain tumor, right through into COVID. So I'm in 2.5 years, heading into my 3rd year soon, of isolation. Treatment-wise, I have to say the Tom Baker was great. They've done a great job with patients when you do go in to get your scans and all of that. The biggest thing was always the interaction with my doctors and my specialists. That and again, the loss of paper. I'm by myself, so I don't have a caregiver or a helper to go with me, so I do everything on my own. So how I get my information, all my documents, all that is really a priority for me because I self-advocate and I'm a self-caregiver too. which my friends would love to help me, but they can't. So I'm in a little slightly different situation with that. Yeah, that's, I guess, the best I can say about that at this point.
Yeah, thanks. Jennifer, you had your hand up there.
Yeah, and then I'll transfer over to Angus there. I just wanted to to answer the question from a caregiver's perspective. Yes, absolutely. So although my mother, I wasn't actively caregiving during COVID, I was there for her 24/7 for 3 weeks while that she was in the hospital, and the same with my father. Those options, albeit differently for each province, was handled things differently, especially on the East Coast. Things went very strict very quickly. So I have friends that have unfortunately been dealing with cancer diagnosis of themselves or a family member, and they are not allowed into the hospital to accompany whoever is getting the treatment. So yes, from a caregiver perspective, absolutely, it's been taken away. And I think that it's very detrimental in that, as Diane was talking about, when you're going through your treatment, to have someone there, and even Shannon with your husband, to have somebody there, another set of ears, another set of eyes to be able to listen. This case with my mom, she was extremely sick. She wasn't capable of understanding everything that was happening to her. So, fast forward to another year from when she passed away. If we had been in that situation during COVID, it just would have been, she probably would have died even faster, which was fast enough. But and to not know, and to not have that option to be there, and have that support. Again, it was different for each province, but yes.
In my experience, that the loss of caregiver participation was probably the single biggest factor. My stepmother was my caregiver, and she would drive down for my appointments and participate with me. Early on in my interactions, I started recording all of my sessions with the oncologist, and he was very comfortable with that and allowed that to happen. And that made it pretty easy to carry on with that. At least on one occasion, and maybe it happened twice, supposedly it was supposed to be a phone appointment, and I just showed up at the office and walked into the clinic and felt quite comfortable with all of the safety precautions and so on that they were taking. But I felt like I needed that contact, and it was important to me to be able to look into the eyes of my oncologist and make that personal connection. And I think that's really self-advocacy. I think that's what I needed. And so I just, did I make a mistake? It's easy enough to apologize, and then they just let me in. But the last couple of times it has been a phone conversation, and I'm comfortable with that, except that I have not tried to record my phone conversations. And that means that my caregiver is kind of out of the loop a little bit, and I can only relate what I've heard. Fortunately, I think I'm pretty sharp at this point. I don't have a lot of mental acuity issues, and so I think I'm hearing what the oncologist is saying for me. The other issue is that a lot of my interactions were from an advocacy perspective. I have this big white ribbon that I can't stuff in my purse that I try and take around with me. And it's really, really hard to stuff a white ribbon into a telephone. You just can't do it. And so some of those advocacy efforts have slacked off a little bit, fallen by the wayside.
Okay. Thanks, Angus. Yeah, so what would you say, and again, here, this is, again, one of my questions out there, and if you have any to add, please don't hesitate to put them in the question or the chat box. And as well as our panelists, if there's anything that you want to bring up, please do so. But did you have, through all of these things, I'm hearing that you were still able to access care, but was there any work that you needed to do to ensure that you continued to have access? Did you have to take any additional steps sort of during COVID to make sure that on your part that you felt you were getting that care, or that you were getting the care that for other people, supporting them? because during times, a lot of times it's easy, out of sight, out of mind. It's a healthcare crisis, so it's everybody on deck dealing with COVID. In Alberta, we had ER docs working COVID wards. We had psychiatrists. I have a friend who's a psychiatrist who was actually pressed to try and go work back on a ward when he hasn't been in a hospital in 15 years to treat anyone. So did that have any impact on you? Did you have to take any steps to ensure that did you feel that you needed to have to take any steps to ensure that? Yeah, Diane.
I think where I had the most difficult time was with my GP. If I had to go in and do anything, that was harder to navigate than with my specialist, which I found just really unusual. But and I think at that point, and as part of advocacy, because I'm also an advocate, GPs don't understand lung cancer. They know very little about lung cancer. So if I'm going in with something that's wrong, I've had to sit and have a long discussion with mine to say, first thing we do is we look at it in relation to lung cancer. Definitely could be something else, but I need you to take every instance of my symptoms and whatever I'm suffering from as that. The other thing too was a little bit of gnarliness with prescriptions and getting prescriptions, because I also have a little bit of a heart issue. So I went to get a renewal and I called the cardiologist, and it took 3 days to hear from them. And then from there, I went to my GP, who took 2 days, who only got me half a prescription because I had to go in and see somebody. But to get in to see somebody was a long process. So that side of it was probably less easy to have than with the process with the oncologist and with the specialist, because I think they prepare for it, and that's a huge difference, is that they know what they're dealing with. And yeah.
Angus, you're nodding. Did I cut you off earlier? Sorry.
No, you didn't. I'm just really thinking, I hadn't even considered really the impacts with my GP, but it's funny. I had my third cancer cut off a few weeks ago. I had a basal cell carcinoma on my arm, as it turned out. But that was the first time I've seen him in 2.5 years. And I bounced into his office, and I was carrying my big white ribbon there. And he and I looked at him and I said, when you gave me this diagnosis 3 years ago, 4 years, it's almost 4 years ago, 3.5 years ago, did you expect me to come into your office like this at this point? And he said, or did you expect me to be dead? And he looked me square in the eye and he said, I thought you'd be dead. And that really kind of shook me, and it made me realize that some of the decisions that were made along the way, it took a little bit of pushing, for example, to get a minor hernia dealt with. I've had a dry cough, which for a lung cancer patient is just annoying. And it turned out it was my blood pressure medication, and it took an ENT specialist to sort that out. And getting those appointments was a bit of a challenge. And it kind of surprised me that my GP was not that interested in it. And I think I realize now why, because he hadn't seen me for 2.5 years and had no idea how well I was doing. And so it was not really high on his radar that I might need to have these minor issues dealt with, because he thought I was dying. And so there's an interesting, by getting into his face and going in and seeing him, because he really couldn't cut that basal cell carcinoma off virtually, it changed his whole opinion of what was going on with me. And he's given me much more attention over the last 2 months than I've seen in the previous 2 years. So that's one big piece that I think really changed. As you started with the question, though, I was thinking about one of my early experiences. I had just been diagnosed as an advanced cancer patient when COVID hit. And so it had taken me, or just after, pardon me, and it had taken me almost 6 months to get my butt into the advanced cancer support group locally here. And I managed to get one meeting in before they went virtual. Well, they didn't go virtual. It was just sort of dropped off the edge of the table. And I called up the social worker that ran it and I said, so, you know, when are we going to start doing this virtually? And she said, what do you mean? I said, well, let's do it on Zoom. PHS or the BC Cancer and the Provincial Health Service have Zoom available. Let's take advantage of it. Let's use it. Everybody else is using it to communicate. Why can't we? And so she said, well, let me look into it. And a few days later, I got an email back saying, yeah, we can do this. And she became the first social worker in BC to run a virtual support group. With the assistance of a very powerful IT department. They got her the headphones and camera that she needed and got her set up. And it, for the first few meetings, I will admit, she and I were the only ones there. But that group is now about 20 people that attend regularly. And it really, when you listen to them talk, to the folks talking, what a powerful connection that is. It's not just lung cancer, about half of them are breast cancer patients, but we cover the full gamut. And we have a few men, which is unusual in cancer support circles to see men coming, but we have 4 or 5 that are pretty regular attenders, and it's great to see that. But I think that's and it's, the interesting thing is that it's spread right across the province. So by virtue of being the first, she has patients from the island and from Kelowna, and we have one from Merritt as well that joins us. So it's really, that's an opportunity that presented itself through COVID. So it's not all negative either. I think there's some things that have happened that are really positive.
So next question I had was, you know, what would you say are the most significant impacts that COVID's had, you know, the public health restrictions that have had on your own care and on your life and the lives of the people that who are supporting you and the people that you're supporting? And, you know, how did you deal with that? And, you know, were you able to deal with that? Were you able to deal with that on your own, or did you take did it take some pushing on your part to get that support from members of your care team?
Well, I have a 14-year-old and a 13-year-old who are in public school. So not only I've got the double whammy of teenagers, but teenagers during COVID. So my life has been pretty severely impacted with COVID. We pulled them out of school for a couple of months in 2020. Yeah, 2020, right before Christmas of 2020. Yeah, we had pulled them out for about 6 or 7 weeks because it was just going crazy. Of course, that crazy is nothing compared to the current crazy with COVID. And it's actually been really hard on my family. My husband's been working from home the whole time. Friends and family are afraid to come see us because they don't want to get me sick. There's a lot of talk about COVID for sure. So the kids are back at school wearing good masks. We've just this school year decided, like, we just have to let them go. I mean, it's their lives too. So I think it isn't just impacting me. My kids are wanting to do all the normal things that teenagers do, play sports, go to the mall, do all of this stuff. But in the back of their head, I know that they're afraid that they're going to bring COVID home and get me sick. So we've been, knock on wood, lucky. So far, we haven't had any infections in the house. Lots of friends with it, but we've been, or maybe it's just been asymptomatic and we haven't noticed with the kids. But it's been a rough go for sure. It's definitely had impacts. And just that sense of fear when you go into the hospital to get a scan. I mean, we're all going in for CT scans. That's exactly where all the COVID patients go, or a chest x-ray. And so mentally, you know, I'm like 15 masks on, trying, you know, is this okay? Are you sure you can scan my brain with, I'm wrapped up like a mummy and in my hazmat suit? But it's been definitely very scary. And the only people that really understand it are either caretakers or fellow cancer patients. So like Angus alluded to earlier, at the beginning of my diagnosis, I was supported in person by people. And since COVID hit, I've turned much more to an online community and online support, Facebook groups, different forums like this to articulate and share stories and learn from people. And it's amazing what you're learning online about your diagnosis. I mean, the big question that I have now is, if I do get COVID, can I take one of the antiviral treatments? Will it interact with my medication? And it's something that's hard to be really proactive about, because I feel like I don't want to bug my oncologist about scenarios that haven't happened. So I think there's a lot of cognizance that people are very busy. Healthcare providers are very busy, and you don't want to ping them with every little concern that you have. So it's definitely had a big effect.
Would you say, and we're getting a little bit off topic here, but in terms of vaccinations, did that provide anywhere from comfort through to actual protection for you, where you felt more comfortable, even just from a mental health standpoint, in managing your diagnosis and your illness through COVID? Was that an important factor in that? You know, you talk about sort of kids being home from school. I have kids who are, one who's now a teenager and one who's just on the cusp. And I know for our family, so being able to have everybody get a shot in the arm has given us a lot more breathing room, just to sort of say, okay, we can, we don't have to be any less careful, but we feel that there's an extra layer of protection for us, just in terms of how we go about living our lives.
For sure. But I think it's also one of these things where, 6 months ago, like in the summer, I felt pretty comfortable going out and doing things. We were all twice vaccinated. COVID was on the decline. Things were opening up here in BC. And then Omicron hit. So it's an up and down relationship with comfort, for sure. And we've had to have some very uncomfortable conversations with friends and acquaintances who have wanted to do things or see the kids, or, well, why can't you do this? And, you have to ask, and, then it's so divisive still. Not so much now as it was, 8 months ago, when there was a lot of debate about it. So yeah, it does give me a bit of comfort. The antivirals give me a bit of comfort, but I still don't know if I qualify to take them. So it's just so many more unknowns in a, pardon the language, but in a shitty situation. It's just made worse.
Yeah. Jennifer. You.
Yeah, so in Nova Scotia, in my province, for the first and second dose with vaccines, just to touch on that, there was no priority given to cancer patients whatsoever. It was rolled out based on age, and on the booster dose, it has changed, but up until that point, it hadn't. So it was hugely impactful in that respect here. People were very, very scared, as Shannon was talking about, fear of catching it, even going to the store or going to the doctor's office, any of that. But the vaccines weren't even an option given to our cancer patients in my province.
Mm-hmm. Yeah.
That's an interesting challenge. So when I started the whole COVID thing, I sort of became aware of it very early on. I was working as a first aid attendant, and I remember my first event when it was sort of in the community and we knew it was happening, kind of thing, and wearing a gown and a mask, and the guy that I was working with wouldn't even go near a patient. So it was, he was so scared of getting it. And it was, my thinking at that time was, well, it's just a virus, bad flu, I'll get it and then I'll be good and I can help people through this process. And shortly after that experience, I met with my oncologist, and he read me the Riot Act. He pointed out how much damage I had done to my lungs with the radiation and the chemo, and that if I got this, and it was a really uncomfortable conversation with him because I don't want to be intubated. And so we had that conversation, and it was, you know, it was a wake-up call for me, because if I got it, it was probably going to be the end, and may still be, but I've come to accept that. So when vaccination came on the scene, I was really excited about it. And I think in British Columbia, we were the first province to roll out a protocol that identified clinically extremely vulnerable patients and prioritized them after the elderly, those in care homes, prioritized them, transplant patients and cancer patients, for the vaccination. And that every opportunity I have taken as quickly as I can to get vaccinated. After my booster back in October, I was, it sent me for a loop, and I kind of wondered, like, was this really worth it? In 3 days later, after feeling like 50–60% energy level, I was at about 120%, and I realized what a psychological boost having that booster had given me, and just the certainty that I was that much more protected. And even now with Omicron, I'm feeling a lot more secure, and just starting to see the numbers rolling out in terms of vaccinated people are much milder, et cetera, though there is still some Delta running around. So you're never quite sure. It could be very serious. And that's kind of, but it was an opportunity again for advocacy, and to let other provinces know, hey, this is what BC is doing, and I think it's excellent. Help your province get on board. I think Saskatchewan was next, and then I'm not sure if it was Ontario and Alberta kind of came on stream with that very kind of similarly, and it rolled out from there. But it was really interesting, just sort of the vaccination advocacy. There was a lot of concern in the cancer community, and I think at one point Lung Cancer Canada was part of taking a full-page ad in the Globe and Mail to say, hey, Canada, we need to prioritize getting boosters into vulnerable people, cancer patients.
Yeah. So again, I'll remind our participants online that if you have any questions, please type them into the question box on your webinar control panel on your screen, and we'll put those to our panelists. And there may be, and I think this is probably the sort of the biggest question that I had in terms of our discussion here. So when we're talking about self-advocacy, and we'll I guess cut to the nitty-gritty on it, what are your most important suggestions for patients and for their support people, for their care teams, when it comes to self-advocacy for cancer patients during COVID, or well, overall, but particularly during COVID? You know, what do you think, you know, from your perspective, are the directions that you went down, and discussions that you may have had with your care teams? What are the things that worked for you that you think, or what didn't work for you, and what do you think needs to change? And with that, from the perspective of the medical community, what are some of the things that you would like them to change about how they have approached your care, or as you know, in particular, but care for cancer patients in general? Can I make that any longer?
I think, go ahead, Diane.
No, you go ahead.
Well, I think, first of all, there's regional differences in how we're all accessing cancer care across Canada. Some BC, for example, is very centralized through BC Cancer. Alberta, I believe there's a few choices. We lived in Toronto for a while, and there's Princess Margaret Cancer Center, but there's a bunch of different places you can go. I can only speak to my experience in British Columbia, and here in Kelowna, the cancer center is separate from the hospital setting. It's the same same location but different buildings, and they basically shut that door March when COVID first came out, and they haven't opened that door between the hospital and the cancer center. Their staff were able to get vaccinated early on and help us. So I don't know that my experience is what other people have experienced across Canada. I haven't personally experienced delays in access to radiation. I had progression in October, and in December I had radiation. I didn't think that was too long to wait, because as you know, they have to do this test and this test and this test before you actually get in there and have your procedures done. So I haven't experienced that. I think when it comes to advocacy with cancer, irregardless of whether there's COVID around, you have to advocate for yourself. No one else is going to advocate for you. So you have to find your big voice and make it heard and be loud and ask uncomfortable questions and push. If there's something that you don't like, I do have some friends that I help support that have oncologists that they just didn't gel with. Ask for a new one, request a second opinion, but push. And as I said, that's irrespective of COVID being in the situation in and around. And maybe there's other people that are watching this that have had delays in scans or in diagnostics, or have had delays in treatment, and it'd be great to hear from some of you in the questions or in the chat. But I just think you got to look out for number one when you have cancer.
Yeah. Thanks, Shannon. Diane.
Yeah, as Shannon says, each region is so different from each other. There's so many gaps and so many holes in not only lung cancer care, but all types of cancer care. So it's a national problem. So that's something that us as advocates can work on. We can join together and create the world that needs to be. But some of the things that you do is make a game plan, right? So build your game plan on your life, because it's the only one you have at the moment. And the one positive I'll say about lung cancer, it gave me the ability, or the thinking, to reset my life and what I want my life to be going forward. So that's a big component of self-advocacy, is knowing that, hey, I can now choose. Know all your options for daily living, like grocery deliveries, prescriptions, all of that. Sit with your caregivers, sit with your whole team if you can, on Zoom. Anyone can set up Zoom. Zoom is free for things like that. So get your friends, your family, probably can't get your pharmacist, but they're way better than I think most of us realize at being support for people with illnesses. Your oncologist, and work out a game plan together. That could be the biggest help for you. But then people know where you are and what your feelings are. Ask for help. Don't be afraid to ask for help. We all tend, or most people tend to want to wear the big boy pants in our disease, and so that people don't think we're weak. It's not weak. It's about having your life. I always, for me, because every day's a tough thing, so I still go to work, so I will see 1,500 people this year in person. I did last year, I did the year before, so I keep different protocols for myself. I've also threatened all my clients that if any of them kill me, I'm coming back and getting them. I'm just a big meteor, and that's what I'm coming down as. So just, if you hear of that, you know what happened. And that's just my joke. So a sense of humor is really a big thing to have. You have to laugh at some things in what happens in your life, or laugh at other people and with other people. Laughter releases all these fabulous chemicals, so go with that. Journal. Do a daily journal, write everything out. It releases so much pressure and stress, especially if you're having a bad day. Blow it out on a piece of paper rather than a person. That's a big help, and it also helps you clear and clarify what you want your life to be. Yeah, build that strong relationship. Ask questions and do not settle for an answer that, well, we don't know, or it is nothing. If you have it, it's something. And so don't let it go until you have a definitive answer. That is so huge. When I was originally diagnosed with my lung cancer, for a year before, I was having weird feelings in my lungs, in my chest. So I went on asthma medication, this medication, that medication. Well, guess what? It was lung cancer. So until you have that definitive answer, don't let them off the hook. Because it's your life and you're the fisherman. Always, so get up in the morning with something to look forward to and something to do and something to challenge yourself or to be a champion of. I think and I know a lot of people that are families and have, children that are going to have grandchildren, that's been their focus, and you focus on that. And if you can do that, it will give you that, I want tomorrow, I want the day after, I want the day after, I want the day after. And become an advocate. Help us help lung cancer become an inconvenience in this country. I think that's where we need to be. It shouldn't be a death sentence or a deadly disease. It should be less than the flu.
Thanks, Diane. Angus, is that you're sitting closer to the camera? Is that?
Not excited. This is really my ask questions. That's ask questions, and everybody else has said exactly the same thing. If you're going to advocate for yourself, you need to ask questions, and you need to listen to the answers, and you need to discard the ones that are complete bullshit, and then move on and find the ones that'll work for you. As you were talking, I was thinking about certainly the biggest impact on me has been the isolation. My wife died just prior to COVID of pancreatic cancer. And so I am here alone. And then, of course, the two cats that were giving me some physical contact and allowed me some release of oxytocin went and died on me too. And no, I didn't kill them. The vet euthanized them. But they were old, and it was time, and I knew that. But it was so that lack of physical contact has been big. And I would say that one of the things that's happened for me is that I have been able to use the online media to really connect, and I think that is become so valuable. I spend about 20 hours a week on Zoom. Of 70 hours that my little thing tells me I'm spending on the computer, 20 of those hours are spent in Zoom meetings, either with advocacy, with other groups, and just with friends. So it's been really important. But we were talking about success and getting up in the morning and giving something back. And I wanted to relate a little conversation. And for those of you who are poetically minded, you will understand that a sestina is a pretty complex poetry form, and I just like to read this one because I think it really encapsulates a lot of what we struggle with as cancer patients. It's called Fatigue. Well, doctor, this is my body, and though I'm your client listening to your drone voice feed, this isn't about you, it's about me. No, there isn't any symptom in particular. I just have fatigue and too much grief. The thing is that with all that grief, I seem to think it won't change my body, but it does, though nothing in particular. Yes, I know I'm your client. I need you to listen to me. It seems like nothing, but fatigue's not chicken feed. Now, if I were a horse, I would say I'm off my feed, but I'm eating like a horse. Good grief, don't try to shame me. This is the strangest sensation to feel in my body. In computers, we speak about server and client and disconnected between thought and action in particular. It's like I'm standing back watching particular movements of my hands and feet, wondering whose they really are. Some client is playing a litany of gloom and grief. I know that it's my body, though it just doesn't connect to me. The fatigue sneaks up and ambushes me when I'm doing things that I love in particular. I end up betrayed by my body. And I wonder if I'll always feel this way, and it fills me with grief and leaves me feeling like I'm going over a cliff. I'm glad we've had this talk as client and doctor. It helps to know that you trust me. And while I feel overwhelmed with grief, you have some ideas that can guide particular changes that will feed my self-confidence and trust in my body. As tiring a client as it feels to particularly be me, you don't see a need to feed me malarkey about my body or force me to let go of my grief. And that's how I deal with some of the challenges.
That's great. Well, thanks, Angus. Yeah, Jennifer.
Yeah, so I just pretty much the same as what others have said, but I just wanted to emphasize that absolutely you need to use your voice. And probably with COVID, not probably, you had to use your voice louder and continue to use your voice and be as loud as you possibly can. It is your life, it is your loved one's life. And it's absolutely okay to push and ask the questions. Just one story that I wanted to tell you about with my mom. There was one day in the hospital, and all the specialists were coming in all at the same time. I swear there was probably 5 or 6 doctors that came in, and it was really overwhelming, even from my perspective. And I wasn't the one that was, really sick. And they were using a lot of big words and a lot of different terms, and I was asking a lot of questions. And after they left, and it was almost like the air just settled, they left, and my mom looked at me and she said to me that day, she said, Jennifer, it's okay. They know what they're doing. You don't need to ask the questions. It's okay. And I'm like, you know what, Mom? It's not okay. It's okay for me to ask those questions. Just because they're the experts doesn't mean that there's not something that they're missing. It doesn't mean that there's not a question that might bring another opinion to play that will make an impact, a big impact. And I think that from a caregiver perspective, it's so crucial to be able to be there, to be that second ears for the person that is dealing with the treatment at that point in time. And my mom actually had suffered a really bad cough for 6 months before we got the possible diagnosis, and they kept treating her and mistreating her, and the things that I wasn't going to the doctor's office with her at the time, they kept telling her it was pneumonia, and it kept coming home, and I was like, that doesn't make any sense to me, and it just wasn't sitting right. And I should have, in hindsight, gone with her at that point in time to ask more questions. We just didn't realize how sick she was. But the very weekend after she ended up in the hospital, we actually found out that there was a spot. She had broken her rib in 2016 and had gotten an x-ray for that. And on that x-ray, there was a spot seen in her lungs. No one followed up on that. Nothing happened. So, I'm not going to go down the road of what ifs, but really, that's 3 years. 3 years could have made huge difference in what we were dealing with, and that was never caught and never questioned. So yeah, that's my contribution to that, is just be loud. It's okay. You're not going to, who cares if you come off as rude or whatever, that just ask those questions. It's your right to do that.
Thanks, Jennifer. Well, I'm conscious of time here. We're sort of almost at the hour mark. I don't see any questions coming in online. I don't know, Yeshua, if you see any on your side, but I think that's probably a testament to the perspectives and the experiences that our panelists have been able to share with us today on self-advocacy in the time of COVID. So I really wanted to thank you all for being able to join us today, and for giving your time and your insights into this. I think that our participants online right now, as well as those who are going to be able to review this on YouTube starting tomorrow, will be able to take some really important lessons and some insights that they can apply to their own situations. And that's thanks to you and for your support on the CCSN. Yeah, Angus. Yeah, go ahead.
One last comment, and I see Diane wants to make one too. I heard yesterday the statistic in British Columbia, there are 870 delayed surgeries between January 21st and January 28th. That number shocked me, and I know without a doubt that a number of those will be related to people's cancer. And cancer is not something that can be delayed. It has to be dealt with in an urgent fashion. And I think that that's one of the problems that I'm seeing right now. And the second one is that if you have what you think are symptoms of cancer, go get it checked out, because I think there's a huge hesitancy in people to get out there, to go to their doctor and get those things checked out. And I think that we're going to see a wave like we haven't seen before of secondary effects, ripple effects from COVID in the cancer world, of people, of a massive wave of people that are now being diagnosed, and it's going to be later stages than it would have been if they'd gone at the first niggle. So those are my two take-home messages for people.
Diane, you had your hand up there as well.
I have my final comment. Sorry, Angus. So for me, it's about, remember, it's your life, it's your future. It's also, and we all forget that everything we do in life has an effect on somebody else and how their future will be. So we are the ripple in a pond. And that ripple goes out to other people who create a new ripple, who create the universe tomorrow. So always, I keep that in mind all the time, and that is one of my go-tos. So yeah, you are important. Everything you do is important, even if you're blowing your top, because blowing your top could be the catalyst that creates the change.
Now, I do see here that we do have a couple of questions online. I don't know if our panelists would can stick around.
I just wanted to mention really quickly, when we were meeting with the elected officials, one of the things that I had said a few times, and I think it stuck with them, I hope it did anyways, was that although COVID has been the topic of, top topic for the last 2 years, COVID didn't stop cancer. Cancer's still here. It's still happening every day, and it still needs to be a priority. So that's my little soundbite, is that COVID didn't stop cancer. I'm sure I didn't create it, but that's one of the ones that I mentioned a lot.
Sure, absolutely. Now, Yeshua is saying here that we do have a couple questions online. I can't see those, but if people are willing, maybe we could just get Yeshua to ask those, if we have a couple more minutes here.
Yeah, so I've kind of been watching the chat here and the questions section. So we will try, for the sake of time, just to move through them fairly quickly. You guys have been so exhaustive and helpful and insightful in your in sharing your experiences already. But this first question from Sarah asks, what kind of supports do you feel it would have been good to have that you did not have when you were first diagnosed? And that applies to caregivers or patients.
Access to support groups. It's probably there in the background in every cancer agency or center across Canada, but they don't bring it out enough. I feel that if I had had peer-to-peer support in the beginning, mentally I would have been better off.
Resource, another one. Like you weren't given any resources like exercises or programs, and a lot of times they talk to you, especially if you're someone who had surgery or you're on major medication, they're talking to you and you're as clueless as anything in life. You don't even know who you are, and there's not that follow-up that happens that says, hey, we have these programs. But when I was diagnosed, they didn't have the programs, first and foremost. But knowing what's available to you that you can use to help you in self-healing and self-advocacy.
This next question is similar, and you guys may have already addressed it to some degree. But there's a person here who is interested, they're a retired medical radiation therapist, and they're interested in potentially starting a patient and family advocate company, is the way they worded it. I assume that's to help speak out and help bring attention of those who aren't as outspoken as you all have been. They go down, they go on to say, like, you guys are all really well articulated and you're very clear in how you express yourselves, but there are some in the cancer community who aren't. And so they're thinking, would this be, do you see a need for this sort of organization?
I already have one. So I have a charitable organization, and our mandate is to support and help advocates become advocates. So that's part of our mission. So you can give them my information and I can help them along the way for their own as much as I can.
I think it is an important service to have for people. For example, my mom is on her own. My dad passed away from cancer 7 years ago, and she is in her late 70s. During COVID, if something were to happen to my mom, I may not necessarily have been able to help her at the peak of some of these outbreaks in hospitals and stuff. It would be possibly sacrificing my health. So somebody in my situation, I would love to be able to provide her with an outlet, a trusted source, and an advocate to speak on her behalf if I was unable to be there.
I'm going to come off as the negative voice here. I see so much duplication. I see so many organizations stumbling to trying to connect with patients. And my advice is to hook up with organizations that are already doing it and join forces with them. I don't think we need another player in the field. I think what we need is more unity, more harmony, so that we're not duplicating messages. Don't get me started on the duplication that I see in the advocacy realm, but it really, yes, 3 years ago when I started, I struggled to find those connections, but I think that we're out there making our voices heard, and through organizations like Ccsn, through the Canadian Cancer Society with their online forum, Cancer Connection, through Lung Cancer Canada, through the Lung Health Foundation. All of these organizations are starting to offer support, and it is challenging when you need that personal connection, but I don't get the sense that's what you're talking about here. So that's my take on it.
Diane, one more thought?
Yeah, no, so yeah, and I work with all of those organizations as well, and we have our connections and what we do, because there's so much that's gapped in lung cancer. They can't do everything either. And if they spread themselves too thin, they're going to fall apart as well. So and that's where dialogue comes in. So I'm in dialogue all the time with Lung Cancer Canada. I work with different organizations, and maybe what this person's looking at is something that nobody else is offering, and that they can connect and develop, and it fills that gap and that hole in there. I mean, and that's, again, researching, finding out, sourcing out, and having a look. It doesn't always mean you're wrong in doing something. It's just what is it that you're doing, and connecting with all the other people so that all of us can work together to build a stronger community, because right now there is not a Canadian seamless anything at all.
The market research, I think that's what we're saying.
Yeah.
I think it comes back to a provincial, it's different in every province. And also it would be absolutely amazing, and it was Diane was talking about that earlier, to have a centralized resource that everybody could access, and you could find those organizations that are already doing it right now. That would be helpful.
Yeah,
as a community service locator that is designed to do exactly that, and it's a crowd-funded piece. So if you've got information, put it in there. and let them know about your organizations.
Sorry, could you repeat the first part, Angus, just so we know where that resource is?
Oh, it's on the Canadian, on cancer.ca, and it's called the Community Services Locator. It's geographically based, so, and it also, it's very much a piece of work that's in flux. It's something that the Canadian Cancer Society has used for years, but they've taken it through their info and helplines, but now they've taken it online, and they're really working hard through their IT department to make that a very up-to-date and useful resource, including trying to figure out ways to connect people through some of the social media things that happen.
That's great.
So-
I just want to, oh, go ahead, Diane.
Sorry, just real quickly, Angus, can you put that on the patient advocate sites? Because they don't know about it. And the only way they're going to know about it is if they read about it. I'm funny about that. I know. What can I say?
You don't know sometimes what you know, and because I was part of the focus groups around that, I know intimately exactly what they've been trying to do with it.
And that's part of what we need to do as a group and as a community. Pass it out.
Yeah. One more resource I'm going to very shamelessly plug is our own website, survivornet.ca. We have patient groups for all different kinds of cancer in organized by region of the country or by province as well. That's a great place, you know, because like Jennifer was saying, there so many things depend on where you are in the country. And if so many support groups for, say, lung cancer are exclusively out west and you happen to be in New Brunswick or Nova Scotia, it's going to help, but only to some degree. And so, yeah, cancer.ca or, of course, survivornet.ca would be a great place to find resources and other community groups that you can be involved in. One last question that we have here, and it's a more practical one that maybe you could speak to. Somebody wants to know how they can go about changing oncologists. Do you think your oncologist, do you ask for a change from your oncologist or your GP? And they'd also like to, I'm gonna say they wanna interview their future oncologist before they go with it. Suggestions, thoughts on that question?
I think that's a tough situation to be in. We've just been advocating to be your own voice and to push forward. I know in BC, I've had this question from other patients. You just need to call your local cancer center here in BC and ask for another oncologist. I don't know that you're able to interview oncologists here. And just in recognition of, unfortunately, COVID has made everybody's workloads more onerous. So I don't mean to be a downer on it, but I'm not sure that you could interview. I think you might just get whoever is next in line there. I know people who have requested specific oncologists and they have been able to get them. I think it ties all back into word of mouth, getting on a support group, talking to people in your area who may have an oncologist that they recommend. And, you know, just go with it and keep going until you find one that you connect with.
I'm also aware that a lot of people contact one of the major cancer centers. If you've got the financial wherewithal to get a second opinion from an American cancer center, that's another way to go in terms of looking for a second opinion.
Alrighty, well, thank you all for your time. I think we'll call it a day here. It's been an incredibly informative and great conversation to hear your stories and for you to share your experience. We want to thank you, our audience, for attending today's webinar. And again, just thank you to our panel of advocates and as well as to our facilitator, David Klug, for his question and leading our discussion today. This is the last of a three-part series in our Cancer Can't Wait / Virtual Action Week webinar series. The first two happened in the back end of 2021, and this one is closing it off now. Registration information for our next webinar will be out soon, so watch your inboxes, and social media for that. A quick note about email. If you're not seeing our emails in your inboxes, please check your spam or junk mail folders. We use a third-party email service, so please check your spam and junk mail and mark CCSN emails as safe or add us to your contacts so that you can ensure that our emails come straight into your inbox. As always, you can check survivornet.ca for previous webinars. They're accessible there, as well as to find a local support group and to find more information on the many different cancer types that are out there, to find local resources, support groups, and who knows, you may run into one of our advocates, our panelists here on the web in one of those groups as well. So I just want to thank you all again for attending, and thanks again to our panelists. Enjoy your day. Bye, everyone.
Thanks very much, everybody.